Hello, everybody. Welcome to the ASAP 2 Closeout webinar. We're really happy you're here. We're just going to give it a minute or two for more to join, and we'll get started. Welcome, everybody. We'll get started in just a moment. If you could put your name and your organization and the country where you are, we'd love to see who's in the room. It's always fun to scroll down and see all of our friends' names show up. Thank you. Okay, well, let's get started. Welcome to the Closeout webinar for ASAP 2. We're really happy everybody's here. This is a special occasion, and we have lots of things to share with you. Just a few tips here. Please use the chat box with discretion. Please use the chat box for questions, and use the Q&A box to ask questions. It is from the Q&A box that we will be answering your questions. Despite what this says here, there will be no poll, and today's presentation will be on the ASAP webinar website immediately after this meeting. We have a few upcoming webinars. We're in today's Closeout webinar, Path to Prime and Road to Sustainability. It is the season for PEPFAR expenditure reporting and human resources for health reporting. So please, if you speak French or Portuguese and you want to attend those, please join those webinars. Today's agenda is we're going to first have a presentation from the Contract Officer Representative Debbie Khalil. I'll provide some achievements and legacy tools that we are leaving for all of you. We have a beautiful video on Ishtu's story. And then our Senior Capacity Advisor, Andrew Kokosi, will be doing a presentation on capacity strengthening through organizational assessments and financial management and compliance. And then our Senior Advisor for Leadership and Governance will provide her experiences on organizational strengthening for Board of Sustainability and why it is so important. So let me pass this over to Debbie Khalil. Thank you for joining.
Great. Thank you so much for having me. And it's been an honor to be the Contracting Officer Representative, or COR, for this ASAP project over the life of the full work, starting with ASAP 1 and now ASAP 2. And for those who don't know the COR acronym, I'm really the counterpart of Catherine Brokenshire Scott at USAID. I work in our Office of HIV/AIDS in our Global Health Bureau, and really have been part of the design and implementation and management team for ASAP since its inception. So I'm just going to take us back a minute to think about why we started ASAP to begin with. And many of you know that in April 2018, our former PEPFAR ambassador, Birx, set this ambitious goal for PEPFAR across both CDC and USAID. She pushed us to try to reach this goal of getting to 70% of our funding going directly to local organizations. And at the time she said it, she put this goal of trying to be achieved by FY20. Really ambitious, given that this was set in the middle of our fiscal year 2018. So really, really pushing CDC and USAID to increase these direct relationships and direct funding. When we began to think about how we would do this, we heard from many of our USAID teams and others that this is going to be really risky, that this would be so hard. Many people said we don't have the staff at USAID to do this. They don't have the skills to support our new local partners. We heard that there wasn't enough flexibility, that we needed more time and we needed to be able to have more flexible approaches to working with local partners. We also heard this perception that we didn't have the capacity, some of our organizations didn't have the organizational capacity to support being direct recipients of USAID funds. And we also heard that there was sort of a lack of sharing across countries, and that we needed to be able to learn, since some countries had made progress already in this area, that we needed to be able to learn better from each other. So part of what went into the design of the ASAP 1 project and 2 was taking into consideration all of these risks and this goal to make sure we had some support to help our local organizations and USAID overall to achieve this 70% goal. So the first strategic objective of ASAP was to strengthen local partners as they transition to receive PEPFAR funding and to comply with all of the USAID prime partner regulations. Our second objective was really to prepare local organizations, local partners, to be successful in directly managing, implementing, and monitoring PEPFAR programs. We still needed to be able to maintain our ambitious targets and quality of programs while we were making this dramatic shift in funding as well. And what I want to report and share is that looking back over time, we have made just incredible progress globally at being able to increase the amount of money going directly to local organizations. So while we were not able to get to that 70% in FY20, we have just made steady progress thanks to the support of ASAP, our USAID mission colleagues, and all of you on the line to get to this increase in funding. So in FY24, this fiscal year currently being implemented, we are projected at 66% of our USAID PEPFAR dollars going directly to local partners. That represents over $1 billion each year that is going to local organizations. So really a huge growth in the percentage and dollars as well. What we also want to highlight is that it's not just money, but that our local partners are also delivering the bulk of our portfolio. Here are a couple key indicators that we look at for our PEPFAR programming. And you can see over 60%, in some cases 70% of these programs are being delivered successfully by local organizations. And when we've looked at the data, the quality of the program is comparable to international partners, and the achievement of results is also comparable. So a great success in delivering and receiving the funds. While PEPFAR has been advancing these goals really over 6 years now, USAID, also under Administrator Samantha Power, has also pushed localization across the whole agency. And we have 2 particular goals at USAID related to direct work with local organizations. The first is this goal to have 25% of our agency funding going directly to local organizations. And the second goal is more around elevating local voices to be part of our decision-making and planning and directing how we do business. So there's a goal to have 50% of our programming directed by local organizations. And across the agency, now this is looking agency-wide over many years back, we've seen really a sort of low, steady-ish state of funding to local organizations. Around 5, 6, 7% of the overall agency budget has gone to local organizations directly. But in the last couple years, all of a sudden, there was a big bump up. And really, this is happening just as these localization goals were being announced. When we dig into that, we see this is looking across different sectors of USAID: democracy, economic growth, education, health, humanitarian assistance, and so forth. We see that health is really driving that increase, and health funds are really where the bulk of the agency has direct local partner awards. And much of this is because of the HIV portfolio growth. I wanted to highlight that not just, again, we haven't just been focusing on increasing the dollars, but really thinking about how we can work better with local organizations, how we can build stronger relationships and connections and elevate those local voices to USAID in decision-making settings. Thanks to ASAP, we've been able to host a series of local partner meetings, both globally and regionally. And here's just a snapshot of one where we had a forum for local organization representatives to talk directly with the USAID administrator power on issues that have been affecting them and recommendations for how to work better with local partners. And I'll just conclude with saying there's so many things that the ASAP project has contributed to. Here are just a few that are very significant for us. That ASAP has supported 126 local NGO partners and government partners to build that organizational capacity to be able to be successful USAID recipients. ASAP has also supported 41 local organizations to become new prime partners with USAID and really helped increase that dollar value and technical capacity, organizational capacity to manage funds. And as I noted, ASAP has helped host 5 local partner meetings, really providing a chance to elevate local voices, to bring to USAID leadership issues and challenges that they face in dealing with managing USAID and PEPFAR programs. So with that, I will turn it back over to Catherine to run us through the rest of the agenda. But a huge thank you to the ASAP team for really a lot of success and support in getting us to those goals that we are so close to that 70% now, and have the capacity of so many of you on the line to be able to deliver successfully our PEPFAR and USAID programs. So thank you all, and thanks to, if we have any mission colleagues who have supported us in this endeavor, and of course also the local organizations, yourselves, for all the work you're doing to achieve these results. So over to Catherine.
Thank you so much, Debbie. So let me move the slide. Oops. I think I forgot to introduce myself at the beginning. My apologies. I'm Catherine Brokenshire Scott, and I'm the project director for ASAP and ASAP 2. I want to pick up where Debbie left off in terms of thank yous, so you don't get to the end of the project without having appreciated so many people dedicating so much time and working together to achieve all that we have achieved. So first, I'd like to thank the COR management team led by Debbie Khalil and Callie Wolfswong and Courtney Aaron. So we met every single week over 5 years to get guidance and to work together through all of the different activities. And it was always done with providing very thoughtful guidance and with kindness. So thank you so much to the USAID team. I want to thank all the local implementing partners for inviting us into your space to help with the path to Prime and Road to Sustainability. We learned from you and we shared your successes. I want to thank the 73 capacity advisors who joined and provided on-site continuous embedded TA to help local organizations navigate the changes to be in full compliance and institute best practices. And I want immense gratitude to the Deputy Chief of Party, Jonas Asfar, He kept all the pieces moving and in full compliance, and we provided seamless leadership and was a joy to work with. And Vicki Hayes McGee, who is our contracts manager for timely management of contract requirements and providing country support as well. I could go on for everybody, but I'll just list the names here. So Sean Aldrich, Samrit Dabebe, David Bwaski, Nancy Erickson, Karina Fales, Karen Ganter-Luke, Amy Gastinger, Bashir Gafarze, Gultane Kibede, Fikre Keith, and Nicholas Masiko and Hinak Yemen. So thank you all to the team. We've worked really hard, and it's been a pleasure to be a team together, and we will certainly miss each other as one another while after ASAP ends. So Debbie has already covered this. I'll just point out that ASAP 2 is ending October 31st, 2024. We've had several consortium members on the contract. So we had Deloitte providing government-to-government support. We had Foundation for Professional Development providing communities of practice and training. Right to Care provided strategic information leadership, and Sustainability Solutions helped develop the NUPIS Plus and conducted most of our assessments, and also provided USG rules and regulations training on an ongoing basis. We worked in 18 countries over the lifespan of the 2 projects. We worked with 126 local partners in total, and this is the breakdown of how many local NGOs and how many government-to-government partners. And 41 of these organizations became prime partners. So we've done 122 organizational assessments, 41 organizations became prime partners, 73 capacity advisors. We helped 81 boards. We created 400 templates, policies, and procedures, which we will leave behind for all of you, and we translated over 400 documents into the different languages. Overall, again, our 126 local implementing partners and 41 became prime. For the NUPIS score is from 1 to 4. So our average baseline score was 2.9. And at the end of the project, it was 3.3, which put everybody in very strong capacity. Here are the numbers for us. I'm not going to read them for you. They're all there just to point out that the communities of practice down here were very popular and got more and more popular as time went on. So thank you everybody for participating in those and making them very successful. We started our journey with local partners by building trust and commitment, and we did this by developing a memorandum of understanding, and we negotiated the different points together. We would outline what we're each responsible for and how we wanted to work together. On our side, we said that because all of the capacity advisors and team members had signed non-disclosure agreements, that all of their information would be held in the strictest confidence, and we would only share it with USAID and the LIP directly. So we've never shared data across LIPs. Sometimes we have aggregated data, which you'll see below, but you won't be able to see which organization. We committed to conducting the NUPIS Plus in a transparent manner, to co-create the development plan and provide continuous on-site virtual TA. And for the local partners, these were the standard responsibilities that they agreed to, and they would add in a lot of other ones that were important to them. And so each MOU was unique and established the relationship, and we could go back to it in case we ever we're not we're not abiding by the values that we stated. This slide shows you our NUPIS. So NUPIS stands for Non-US Government Pre-Award Survey, and we're on version 2.1 now. So version 2.1 incorporates USAID's new NUPIS, which became in effect in August 2024. So it includes all of the 60 questions in the USAID NUPIS, plus It's spread out over 19 domains and has over 247 questions. And the table in the middle shows how many we've done per country. And then on the right-hand side is a technical brief that we prepared on our NUPISes, which is available on our website. Just to articulate the evolution of the NUPIS. So first was the NUPIS, USAID's NUPIS, which has 6 domains and 28 questions. Then we added domains, and then after 2 years, we upgraded it to 2.0, and we added these domains. And then just as we had finished that, USAID launched their new NUPIS, and so we updated the NUPIS based on their 60 questions. This is a busy slide, but I want to walk you through it. So this shows you the domains that were of the highest risk and greatest success. So the way to read this is row 1, monitoring and evaluation. 34.2% of the organization had inadequate or weak systems. By the end of the project, if you go to the last column, you'll see that 96.5% of the organizations had adequate and strong systems. So for sustainability, 26.4% were weak, and we're leaving them at 93.4% as strong. The provisions increased up to 92% were compliant. Business development started at a weak 32%, had weak capacity, and because we did so much training and developed a training manual. In fact, we're having a French webinar on business development tomorrow. 92% of the organizations met the standards for having a strong business development practices. For governance, 27.9%. This increased to 92%. Property management, 28%, and goes to 90%, and so forth. So I'm not going to read all of them. I will jump down to these yellow squares because I want to explain why they're different. So for information technology, 44.7% had inadequate or weak capacity. This was alarming to us, as everybody that is working needs their IT system to be functional. So at the end of the project now, 82.3% have strong capacity. Meanwhile, only 17.7% had weak. So we had no red scores. We had no high risk, the highest risk category in the assessments. So that's why these squares are yellow, and the ones that are orange combine the red and yellow scores, red being high risk, yellow being inadequate. So again, I'm not going to read all of them. You'll be able to access these slides on our website after the webinar. Amongst the domains, we were able to pick up some trends on the highest risk areas across all of the NUPISes that we did. So number 1 and 2 had to do with risk management. So risk assessments and risk reporting were alarmingly high. Over 68% of the organizations did not have adequate systems for that. For IT, it was disaster recovery. For governance, board evaluations, gender analysis. Organizations didn't have resource mobilization plans. The IT department didn't have risk mitigation plans. Finance, cost allocation was always a risk area in all of the assessments, and was able to convert over to high performance areas in the follow-up. Mandatory standard provisions, gender roles and responsibilities. For procurement, organizations were not doing the terrorism financing check. For organizations weren't also instituting the conflict of interest forms signed on an annual basis. Cybersecurity, another one for IT, and the provision. So you can see IT and risk management featured in the areas of greatest weakness amongst the 126 local organizations. So this domain is called sustainability, and it pulls together all of the domains from specific criteria from other domains. So this is a composite indicator. So you can see we're very happy that we've achieved 100% change in organizations. I want to point out here that the baseline was 80 organizations and the follow-up only 25. We wish that we had had the funding to conduct follow-up assessments on all of the organizations. We did not have that funding. Instead, we targeted certain areas per the organization. So we only have 25 complete NUPAS Plus assessments where we conducted the entire 19 domain assessment. Let's let you browse that for a minute. And for governance, we had tremendous success here. You're going to hear more about it from Petronella and her presentation. But again, we've done converted high-risk areas to 100% being strong. Everything was in the 90s except for board evaluation. So still we have a lot of organizations not complying with the or not instituting the concept of a board evaluation, but these are very insightful exercises and well worth the effort. For monitoring and evaluation, we also had tremendous success with all items reaching over 90% of strong capacity and many criteria having 0 weaknesses at the follow-up. So that's enough about our NUPASs. What I'm really excited about is to share with you our Path to Prime. So we've created a document called Path to Prime and Road to Sustainability. And you can, when you see the slides, you can open the link here and you can access the document. We've translated it into French and Portuguese, and it will be available soon on our website. Sorry, we've translated it
Apologies, one moment. We appear to be having some technical difficulties with Catherine. Give us one moment to try to figure out what's going on. Thank you for your patience.
Can anybody hear me now? Oh, good. Thank you, Sarah, for
Yes.
saying yes. Oh, fantastic. Okay. So this slide shows you when you go into the Path to Prime document, you will find hundreds of templates translated into French, Portuguese, and Swahili. And at the top, it says this template is available for local organizations to adapt and edit to fit your needs. So these are all Word documents that you'll be able to convert. I just picked two here so you can see what they look like, but there are hundreds of policy documents for you. Within the document as well, you'll see links to all the USAID compliance requirements. So all of the standard provisions, the USAID audit guidelines, there are many here that you'll have the direct link to these documents. We've also translated these documents into many languages. You'll have access to the NUFAS Plus 2.1. There's additional resources there that ASAP and IntraHealth has created for you. And you'll also see, again, all of the policies and procedures that implementing partners must abide by this guidance in implementing their programs. So it's a one-stop shop. Everything is in one place. We're really happy with leaving the project with this in your hands for you to help, for you to use to help on your journey of Path to Prime and the road to sustainability. We've also developed many training materials. So we did a board leadership manual, sub-award management, business development, NUFAS Plus 2.0. We didn't have time to update it to 2.1, and strategic information for local partners. For global activities, we were responsive to USAID in conducting the partner meetings. We have webinars in multiple languages, communities that practice in multiple languages, and virtual training. So as Debbie mentioned, the local partner meeting. So we started in 2019 with our first in-person meeting for all organizations on the African continent. And we got so big by the fourth meeting that we decided that it would be best, USAID decided it'd be best to go to a regional platform. So we had our first West Africa regional meeting in Accra, Ghana last year, and we had 550 people attend of 293. And at that meeting, it was suggested that we have country meetings. So now we've held 2 country meetings in DRC and Burundi, and I believe this will be the trend moving forward for country meetings as well as regional meetings. We asked at the meetings what works well with working for the local partners, working with USAID, and they commented on how supportive the guidance was from USAID, from their activity manager, that they liked the orientation process at the beginning of the project to cover all the roles and responsibilities. The monitoring visits were very helpful, and standardized data collection and management tools was very helpful. What they didn't like, what was challenging for them, was the barriers. So they stated that English was not their local language. And so, as I've mentioned previously, we've translated so many documents into 7 languages. Indirect costs and understanding USAID awards was also a problem. So we provide training. We held 116 webinars, and the number of webinars on indirect cost and compliance was the highest, and we reached over 28,000 people. We hired our embedded capacity advisors to provide hands-on support, and we developed all these tools and policies specifically for each organization. Talked about the country level. For M&E systems, they needed to be upgraded to electronic from paper-based. So we made a lot of effort into that. You saw our M&E scores. The salary gap between INGOs and local partners was a constant source of tension, where the INGOs salaries were much higher than the local partners. So in response, we conducted a market salary survey. We used the Birches as our baseline to compare salaries. The Birches is a quarterly survey done.
You've reached the maximum length for voice messages. Goodbye.
Sorry about that. Conducted salary gap surveys, and I'll show you the results of that. And then sustainability, again, I've mentioned all of the documents that we've provided. So all of this is to share that ASAP 2 and ASAP were always responsive to the needs of the local partners. We came where you needed us, and we heard your voices, and USAID heard your voices. And it was really wonderful to work together and to know what your needs are and to help you meet those needs. I mentioned the communities of practice before, so we had a total of over 2,000 people participating in these sessions. We had a total of 49 sessions in 3 different languages and in 3 different topics. This is a list of all the documents that we have translated. Again, you'll find these all in the Path to Prime. You'll have access to the links and you'll be able to download them all for your use. So that is all I have on ASAP 2. Next, I'm going to share a wonderful story from ISHDO, the Integrated Services on Health and Development Organization. Jeff, can you click on the video, please?
Give me just one moment. I need to change my share.
$95 goals, as well as build local capacity to ensure locally led action for sustainable solutions. Accelerating support to advance local partners, ASAP, is the USAID's global mechanism supporting USAID PEPFAR localization effort. ASAP has been supporting local partners to have the capabilities and resources to serve as prime partners for USAID PEPFAR programming in compliance with USAID and PEPFAR procedures. These 2 strategic objectives guide the work and activities undertaken by ASAP. The first objective is to strengthen local partners as they transition to receiving PEPFAR funding as USAID prime partners, ensuring they comply with regulations. The second objective is to prepare local partners to directly manage, implement, and monitor PEPFAR programs, maintaining consistent achievements and quality. To achieve these objectives, ASAP conducts comprehensive organizational capacity assessments of selected local partners using NUPA's PLAS tool. These assessments identify key capacity gaps that need to be addressed to ensure these organizations can effectively receive and manage U.S. government funds. Here in Ethiopia, ASAP began working in 2019 with 10 selected organizations. Based on the landscape analysis, USAID conducted the Integrated Service on Health and Development Organizations, or ISHDO, was among the local partners selected for ASAP technical assistance. ISHDO has experienced a remarkable transformation using the technical support from ASAP. ISHDO has been elevated from a sub-awardee to a USAID prime partner.
ISHDO, as indigenous civil society organization established in 1997, focused on HIV prevention, care, and support activities. This was established by 3 individuals, volunteer individuals, dedicated individuals, who were touched by the rampant days of HIV/AIDS during that time. ISHDO developed its portfolio from HIV/AIDS prevention to other development initiatives. In this case, education, peace and development, conflict management, gender transformation has been included to the HIV prevention initiative. That made to change the name ISABSO into ISHDO. ISHDO is known by donors and international organizations living in Ethiopia. ISHDO is known for its commitment, engagement, dedication, and quality of work. ISHDO is particularly targeting the key and priority population. For this reason, we had a lot of donors and support groups here in the country and outside. Currently working on 4 projects with amount 5.6 million, supported by 4 different donors. Plus this, we are working with 2 big projects supported by USAID. One is through PSI Ethiopia, the other 19.3 million USD is as a prime partner directly from USAID. We are working with 4 regions and other 2 regions, Gambella and Oromia, which are highly populous and highly affected regions by HIV. ASAP and ISHDO are started working together from 2019 after USAID Ethiopia introduced us a technical assistant. We signed a memorandum of understanding and decided to work to manage ISHDO capacity building. Since the ASAP support, ISHDO's capacity is increased in different aspects, like the funding is increased from 150,000 USD to over 5.6 million USD. The staffs is increased from 30 most probably to 200 staffs currently in different regions as well. The scope of area and the number of beneficiaries all are increased. This is made possible only through the support of ASAP.
With the support of ASAP, after we are capacitated, we found another grants or funds from different organizations, particularly from Global Funds, Luminous Fund, and other organizations from EU as well. So we have got donors and funders, and we use the money properly to address our community in different aspects.
ASAP support has been very instrumental. ASAP support has started from the assessment to identify the gaps using the NUPAS assessment tool. The NUPAS assessment tool is this very comprehensive tool which addresses different thematic areas in terms of organizational management as well as program. It includes thematic areas like leadership and governance, financial management and internal control, monitoring and evaluation and quality improvement, human resource management, procurement, and logistics management. So ASAP initially has done a NUPAS assessment in a participatory way, which includes the staff of ISHDO as well as ASAP staff. They sit together to identify the gaps based on the developed tools. And they have, through that assessment, they have developed a tailored capacity building plan for ISHDO. There are different areas that has been identified as a gaps. In terms of financial management, there are a number of gaps in cost allocation, financial documentation, payroll management and preparation. In fraud management, ISHDO lacks policy on fraud management, reporting and risk management. And in terms of human resource management, there is a huge gap on personnel file management, payroll preparation, and doing reference check for the newly hired staffs. And in terms of monitoring and evaluation, there are gaps identified in terms of supervision and data quality management. Another important gap that has been identified is the mandatory standard provision, which is a core for USAID program implementation. There are lack of policies on misconduct, conflict of interest, non-discrimination, and these kind of policies were not available with ISHDO. So ASAP helped the ISHDO team to address these gaps through different means. It is The main means that they have been using were training, mentoring, coaching of staffs with embedded technical assistance, providing templates and customizing policies and guidelines. There are a number of webinars that have been organized by ASAP and with different thematic areas, and our staff has been involved in many of the webinars that have been organized by ASAP. We also need to do a NUPAS assessment to our local implementing partners. So all our staff has been trained on how to do a NUPAS assessment and on program management, leadership and governance training has been provided to our board members. Quality improvement has been one of the critical activities that we have received support from ASAP. So we have managed our programs, quality improvement activities through the support that has been provided by ASAP.
I wish ASAP would continue, because capacity building is not like just to something that you finish anytime you want. But we understand that we are good enough now to really train our sub partners, and yet the support, if the support continued, I wish it would have been good. But we are doing our best in doing the same capacity building to our sub partners and other local NGOs when they question us to do so.
ASAP, in fact, gave us a training on board management. So from there, it helped us refine and also revise what we are supposed to do as a board member. It's supported, in fact, in a very many ways to rearrange the whole board in a subcommittee, 4 subcommittees, which looks into governance, resource management, resource mobilization, and networking, and others. After having that subcommittee, in fact, we worked very much with the organization and also with board members, and in a way, how to strengthen in these areas, how to contribute in these 4 areas and many more. So revised our terms of reference and also job description for the subcommittee. The training helped us to see things as a whole for the organization's prosperity. I mean, working and contributing to the people. And one thing we did was to develop a job description for the subcommittee and for all subcommittees. And we also developed self-assessment and organizational assessment tools. And we also looked into how we are doing things in a manner that contributes to the organization.
ASAP's ultimate goal is to ensure that local prime partners are not only capable, but also resilient and self-sufficient. By empowering local organizations, the program aims to create a lasting impact on the health and well-being of communities across Ethiopia.
IntraHealth provide technical support for our sub-grantees, including by providing training and different materials like Excel-based tools that help them to have a good and efficient, sound financial management and internal control system.
Currently, IntraHealth is managing 7 implementing partners as part of the family-focused activity and being a prime partner to USAID. And we have been following the model that has been provided by ASAP. So depending on the baseline assessment that we did with our implementing partner, we have developed a tailored capacity building plan. So based on the tailored capacity building plan, We have been working with our implementing partners to find a solution for the identified gaps. Throughout the 3 years implementation period, we understood that most of the identified gaps have been improved among our implementing partners.
Through this expanded network, ISHDO is making a substantial difference in community health, ensuring that the vital resources and support reach those who need it most. The journey from a sub-awardee to a prime partner underscores the power of collaboration and capacity building fostered by ASAP. Now, ISHDO is leading the charge, sub-awarding 7 local partners across 2 regional states. Their reach has expanded significantly, now encompassing 7 regional states and 53 towns. This impressive growth highlights the organization's strengthened capacity and the far-reaching impact of their work. Through the collaboration and dedication fostered by ASAP, USAID, and PEPFAR are paving the way for the future where local partners lead the charge in ensuring a healthier and brighter future for all.
Thank you, everybody. I hope you enjoyed that video. We're so proud of ISHDO and all the work that they have done. And that's just one story amongst many. And we're looking forward for your growth and your sustainability. Next, I'm going to turn the slides over to Andrew Kigosi, who is our Senior Capacity Advisor for Financial Management and Compliance. Over to you, Andrew.
Thank you, Catherine. And I'll just briefly speak about my experience from the side of an advisor. Specifically, I'm the Financial Management and Compliance Advisor. And the areas I'll be covering. Okay, trying to get my video on. So yeah, so the areas I'll be covering, I'll talk briefly about dealing with the tool and some of the benefits I could see from that. Again, we've heard from ISHDO, and we've also heard from some of the primes that are already applying this tool with their sub-partners. So through sharing some of these experiences, maybe it will be beneficial to both how you approach the partners, but also try and understand like the thought process behind some of the assessments that we're doing. So in terms of the tool itself, Catherine has already spoken about the different versions, which brought us to NUPAS Plus 2.1. Again, in terms of consistent improvements. But one of the aspects that we found advantageous with the tool was one was the opportunity for detailed domain analysis, because even for what we discovered, or what I discovered, was even in areas that were scoring highly, we're still able to identify areas of high risk. And if you look at this example that particularly I'm displaying right now, you can see that cost allocation that has been mentioned already as one of the areas where most organizations had challenges. You could find that an area is strong on indirect costs because it's lent on de minimis and strong at authorizing payments. But cost allocation policy is still a challenge. And so this would enable the capacity development plan to focus on where the problem was. But also besides the detailed domain analysis, there was still, the fact that there was, a standard criteria to determine capacity. That meant that, understanding that, these were relatively new relationships, ASAP2 and the primes, are being able to have a standard criteria in order to, indicate where an organization sits had two benefits. One, it enabled quick consensus building, but also, for follow-on assessments, we're still able to, to see this evidence-based kind of, capacity strengthening with the follow-ons, and I'll dive into that, a little more. But also, I may have a strong title, senior advisor, but being able to, assess financial management in a comprehensive way, a tool is usually beneficial because it's able to, speak to the completeness of the assessment that you're doing. so that you do not miss out on some of these areas. So some of what we saw within the assessment findings, you could see some of the manual systems that are coming across, whether it's on internal audit, and this again not being matched by the growth in systems of the financial management, but also aspects around inadequate segregation of duties, weak fraud policies. So there are various areas, and again, each organization was unique. So one area may be strong in financial reporting, while weak on audit. So this kind of opportunity to look at different domains made sure that we end up co-creating a capacity development plan that speaks to that specific organization instead of coming with the one size fits all. And from the results that we see across the lifetime of the project under finance domain specifically, as you can see from this list, with the baseline showing some areas that were relatively strong, whether it's petty cash, but in the follow-on, becoming fully strong for organizations. Again, this being able to tie up some of those aspects, whether it's advanced payments where you have 12.5% representing weak and inadequate capacity, and 87.9 representing strong and adequate capacity, still being able to push by the time of the follow-on to to 100%. Now I'll also quickly just go down to where the yellow is, and maybe just speak briefly about aspects like cost allocation, where we still have up to about 41% that was still showing up as weak capacity. Again, capacity building is aspirational, and as you build capacity in one area, say you're able to get the policies going, you're able to get the initial practices in place. For some of you that have dealt with cost allocation, you'll understand that you suddenly start to realize that maybe there are aspects around how do we have a full overhead recovery. So it's such aspects that as organizations grow in capacity, they aspire for the next level. But all in all, we're able to see growth in all these domains and subdomains, and these organizations have been able to identify their next level of capacity growth. So in terms of this co-created capacity development plan, this was spread out in the different criteria, trying to capture what the score was and what the key activities and deliverables are expected, including the person responsible. And this is an outline of what a capacity development plan looked like for the organizations that we worked with. Of course, part of the conversations we're having was, to what extent can the organizations try, or these partners can try and run consolidated plans, so that you do not have one plan for ASAP, one plan by another partner that comes in to run an assessment, but more and more to try and own these plans in a format that makes it easy for the local partner to actually implement these findings. Now, some of the examples for the technical assistance that we're able to provide, and this is really specific to Uganda and specific to financial management. We're able to review operational policies and procedures covering aspects like finance, procurement, risk management, internal audit. We're able to support local partners to configure and customize accounting systems as they transition from QuickBooks Desktop to the online version. And some of you may know that the QuickBooks company, Intuit, has since stopped supporting desktop version. So again, are trying to provide, whether it's thought leadership or make sure the organizations are actually growing to their systems to match the growth either in their funding or in their general program implementation. We're able to conduct multiple trainings, and Catherine has already mentioned some of them here. I just try to highlight some of the ones I was directly involved in. Again, fraud awareness, risk management, procurement. We're able to guide some LIPs that were trying to transition from community-based organizations to being full and non-government organizations with the registration requirements. And some of these were, basically focused organizations that were coming on board specifically for services that they could provide in certain areas. And then the mentorship, which again is an ongoing benefit to the local partners, because once we engaged with a local partner, it made us available. And even up to now, I have local partners calling me for aspects around compliance or financial management, even as they tap into the communities of practice. So what were some of the success stories? Yes, we're able to do, assessments for multiple organizations. Here I've just highlighted a few. We're able to see functional accounting systems that were able to give up not just numbers, but information that is actually useful to decision makers. We're able to roll out, fraud risk assessment tools for some of the LIPs we're working with. Again, there's risk assessment and risk management and risk registers, but sometimes, it's important to try and zero down on the risk of fraud. Then we had the boards, come in and approve a lot of these revised policies and procedures manuals, which really was the final stage of putting them in practice. Supported one of the LIPs to complete their new strategic plan. Yes, it was incidental to the time of the support, but again, it speaks to the breadth of support that was available to the local implementing partners as we engaged. Completed, comprehensive risk registers, and also we've been able to see some of the local partners, and I would encourage all of you to be able to, use some of these training webinars to cascade these trainings. Granted, some of them may need a bit of, depending on the kind of sub-partners that you engage with. For some of them, you may need to tailor them or kind of break them down into digestible bits, but they are a resource that is available to all partners. In terms of so this is an example of evidence-based capacity strengthening. I earlier spoke about the importance of having a clear criteria, so that if you're coming in a year later to do a follow-on assessment, you're still able to define what was high risk as high risk and what was strong capacity as strong capacity, so that you can clearly track this kind of growth with minimizing the subjective analysis. So what kind of lessons have we learned? For example, one of them is each organization having unique challenges. Making these assessments essential to tailor the capacity building efforts. Again, this is something I mentioned. These organizations, you see them, you engage with them, and every once in a while you'd have an organization ask you, yeah, but we passed the pre-award survey, so that means our system is already strong. But through these engagements, we're able to identify areas where the organizations could still be strengthened. Then again, in high scoring domains, I mentioned this, there could be high risk areas that could require strengthening if we're speaking about overall organizational health. And I think the example I was using was, the cost allocation, where you could be strong with indirect cost and authorizing your expenditure, but struggling with cost allocation, and therefore it's more efficient to just focus the intervention on the area where the gap existed. Then the organizations themselves will often recognize their gaps but lack the resources to address them. And it was good that this was a core assessment process, a core review process, where organizations could be able to because you want ownership. As much as you're trying to work with those organizations, they need to own these kinds of gaps. And it was always good to be able to see that organizations, through their own self-reflections, could identify some of these gaps already, and maybe at that point just lack the resources within their current funding to address them. The other aspect was being able to adopt the NOPAS Plus 2.1, which, yes, included the self-assessments. but also brought this experience from, external assessors. So the opportunity for us to be able to share, what we've seen with different organizations, bring it to the conversation of an organization, because sometimes you do not know what you don't know until, someone is coming in and talking about, this could strengthen you, or you could be adequate, but you're not strong. And so this, new knowledge could get you to the next level. So it was a lesson that we learned. For the non-English speakers, yes, it was important to translate the assessment tool and the CPD. And Catherine has mentioned a lot of what got translated. Then USAID needs to find resources to prepare elements within the CDP. And this may not be everything, but there are certain aspects that would be considered pillars to capacity, for example, an online accounting system or staff positions. So there are aspects within the CDP that could be, like what we may call a bare minimum in order to be able to build capacity going forward. And then lastly is, the opportunity again for the primes to be able to use, this NUPAS Plus tool with their subs, and meaning that if they are actually to take that process, then there is need to include this within their budgets going forward. Thank you very much.
Thank you so much, Andrew. Thank you for that great presentation. Next, we're going to invite our last speaker, Petronella Martha Dubé, to talk about her experiences with strengthening boards and sustainability. Over to you, Petronella.
Thank you very much, Catherine, and good afternoon, everybody. In the next few minutes, I'm just going to take you through this session on organizational strengthening for board sustainability. Very much work that we've been doing with all the LIPs. So what I'm going to do is share our approach to strengthening board governance. The slides are full, but I will just be talking to, more of the headlines of each one of them. But importantly, how we created a safe space for each organization to positively embrace the importance of governance. If you've just seen from our, Catherine and Andrew, the NUPAS assessment was very thorough. So you can imagine how that, with all those governance leadership key areas, suddenly we're coming in and saying, maybe this is where we need to help you, support you. So it was very much about doing it in an emotionally intelligent way. I'll be talking about the strategies we used for each LIP to reflect on their practices, but also the importance of securing buy-in. We're here to help you. We are your allies, and working in collaboration to instill good board governance. And very much we'll be sharing the personal and collective actions and tools used to strengthen each board. So I will not talk through the governance assessments because there's a lot has been discussed already. And as you could see, Catherine actually covered some of those from where we started with the NUPAS assessment results to really, in some cases, achieving, as you could see, for instance, governance structure 100%. So that really also helped the LIPs to see the journey, and it's been really wonderful seeing the impact of that. There are types of boards that we come across after once we've been in each of the organization. There are the established boards with a board charter, presence of 5 to 7 skilled members, because we expect them to have enough numbers to be able to vote, being clear about responsibilities, their liabilities, and of course, looking at the presence of strong systems to govern. And then there are those that are women-led boards. Some LIPs are led by female board chairs, and I think we've just seen an example of that. And some have up to 4 members, which I think it's wonderful for diversity. And then there's the founder member board, very much the executive director in charge, lacking maybe, strategic leadership, board members are friends or allies, absence of clear board terms of references and all those things that we expect. And then, of course, voluntary board. This one is much more token board members asked to join the organization, no formal board activities, no job descriptions, and they almost meet occasionally and used as and when required. So you can imagine with those, the NUPAS assessments, from the results that, came up from that. So I'll just take you through importance of board of directors from our ASAP to, perspective. They're there to help each local partner fulfill its mission and to ensure sustainability, very much through providing guidance and oversight of executive director. This is a key point, one of the key areas that we've had really to get buy-in and change the dynamics from that. But ensuring strong governance structures, financial stability, effective decision-making, and that all-important delegation of authority. Who is authorizing what in terms of finances and some of the key decisions in the organization? But very much in assisting management in understanding and focusing them on continuity, opportunities, and looking at the risks that each organization faces. And each of those boards have also, been very much, trained in that. But also setting up growth strategies and a resource mobilization plan, as we saw from the example given in the video, very much these organizations now starting to be proactive rather than reactive with regards to ensuring they will always have enough resources to deliver on their mandates. And then, of course, there are some issues, consequences of poor board management that we've come across. I'll just share a few. So leadership issues, where, yes, after the assessments, it's clear that some of the boards were dysfunctional. Maybe there's poor performance in what the board is actually supposed to do. And more importantly, an important one was the inattention to results. And then, of course, presence of substantial risks to local partners' long-term performance, strategic risks associated with decisions and their operations, lack of accountability, failure to establish those clear lines of the board oversight, which I will be talking to in a few minutes. Lack of transparency, where you could sense that there's no trust and confidence between the board and management. If you recall from the previous slide, I reiterated buy-in, and by talking about buy-in is how we as capacity advisors ensure that we're able to get that confidence between those two, work with them such that there is alignment. And then, of course, legal risks resulting in bad behavior, some fraudulent practices, and the all-important unclear board reporting processes leading to governance failure. And then, of course, conflict of interest, as I mentioned, with the examples of the boards that we have, very much board members with own personal or financial interests, resulting in a lack of trust and confidence. And then, of course, reputational damage in not meeting the stakeholder expectations, loss of donor confidence. So, we really had to take a deep dive on some of these areas to really highlight to the boards about the consequences. I think the leadership and governance training manual has been mentioned. It's something that I felt I contributed to. So I'm sure you'll be able to tap into that as part of the resource from ASAP. So now I want to talk about the enhancement of the board's role and responsibilities. We made sure that we delivered board governance to each board and executive leadership, always the board and the executive leadership, the two elements on good governance. Then followed up with coaching to each board, sometimes, board chair, one-on-one, but also as a board and with executive leadership on its key obligations, roles, and responsibilities. Ensured separation of the role of the ED and the board, very much the board being there to govern and the executive leadership managing the operations in the organization. And how did we do that? And one of the, you've heard so much about the tools that we've created. One of the key tools was a simple board skills matrix for each board to have the right expertise in the boardroom. Then they can chart, who have we got? If they got finance experience, do they have human resources? Who else do we need? And we also started really promoting things like having someone with experience in programs so that they can sit on the board and actually assist in that drive for outcomes. We also ensured board independence by encouraging, again, the right systems and structures, developed strategies, policies, and as you had tools and frameworks. They sound a lot, but each one was very much tailored to usher in best practices based on the assessments that we had from the beginning. So our focus was very much to work with each board to support and act in the interest of each organization. And then, of course, board strengthening through performance management. Yeah, I think you heard earlier on when Catherine was talking about board evaluation, you could see that that was something that was non-existent. So, our focus was very much enhancement of the board members' knowledge, clarity, and giving them the confidence needed for effective decision-making, skills development for each board. Sometimes I delivered some, strategic leadership skills, on a one-on-one, just to bring them up to that level, moving them from just management issues. Very much refreshing members on effectiveness. I always we always use the word refreshing because I always make sure that we don't assume they don't know. So it's just saying we're revisiting some of these issues whilst optimizing each of the board members' expertise in the boardroom. Presence of board efficiency and collaboration in the closure of any capacity gaps. And of course, that all important, accurate performance measurements, making sure we introduced some tools and strategies on ensuring each level is measuring their performance. And of course, one thing that I think in ASAP we've been really good at, certainly with the teams that, other advisors and the teams on the ground, has been said, ensuring that in spite of us coming to highlight some of the gaps, it's about celebrating success and on the benefits of an engaged and effective board, and especially on how it helps each partner accomplish their goals. Very, very important. Again, another thing we focused on very much was the board's culture. Certainly for me, it's almost like using a thermometer, just, as you come into the organization to try and measure where our people are at. So it's really working with them, each board, on key areas and analyzing and measuring effectiveness. I think most of these we've probably already talked about operationally, financially, making sure they're keeping track of the key risks. And by doing that each organization has got a register. They know the big risks, those red hairy risks that are likely to impact on their organization, as well as some of the smaller ones, to do with human resources and, otherwise. But someone is responsible. They're checking on all those, and that the main risks go to the board every quarter, and there's a board reserved matter agenda where risk is discussed. So very important about, that continuous improvement and ensuring reporting systems are in place. And then, of course, evaluation and measurement of board effectiveness, which I've just started to talk about. Our aim was very much focused on board assurance and reassurance that all measures and controls put in place are effective. So within the training, very much reiterating, your role as a board is to ensure that the information that is being presented to you is important, is the right information. And then how do you as a board then get reassurance that everything is as it should? Very much about board briefings on financials. Are we on target? Implementation of strategic program execution. Do we have enough resources to achieve our mission? That's the questions that we will expect from the board. Of course, risk, I've talked about that, but very much each of them at a high level, looking at where is our organization vulnerable and what are we doing about that? So each LIP addressing issues it is facing, agreeing on options with the board to consider and actions to take, in that they are mitigating those risks, and that there is a key manager to oversee the register and report to the board. And very much, of course, another key area was the board and directors themselves, not only just assessing internally, but themselves in terms of one-on-one and as a core group as well. And then, of course, the strengthening of ED for sustainability has been pretty key. Again, the importance of having good strategic executive leadership has been part of addressing those capacity gaps. Presence of, that big picture focused thinking for the executive leadership, but also clarity about that strategic plan, the vision, the mission, the roadmap, and working in alignment with the board. And of course, the strategic plan is very important for the board to ensure that they will always have enough resources to deliver, on their strategic intent and the goals and objectives that they've set themselves up. So it's about ensuring that execution of those objectives and also measurable impact, but also ensuring the LIP efficiency and creativity through deployment of managers with appropriate skills and competencies. So it's not just the board, but also those senior management. But that last bullet point, very important. Strengthening the executive leadership for sustainability is very much about gaining commitment from all their key stakeholders. And I always, we really reiterated the importance of stakeholder management and networking. As I said, working with our LIPs to say, don't be reactive, but be proactive. Your donors should be your allies as well. You talk about where you're at, you share what you're doing, but being very much on top of the issues for leadership growth. And of course, here you can see some photos with, most of us, our advisors, we've, spent time with colleagues. Again, we are all friends and, supporters now. And as my colleague Andrew mentioned earlier on, it's so interesting. Literally, even yesterday, I got an email. The colleagues, most of these board members and executive leadership are now in touch with us, just checking in, or, I've forgotten about this, can you share this tool? And that's where with ASAP, we've really managed to really hit, the right level in terms of dynamics with the people we work with. The documents that we've worked on as well, you've heard quite a bit about this, but very much from the board constitution, just ensuring that each board is clear about the terms of references, what they're about, how do they monitor themselves, but more importantly, how do they work with the executive leadership? So their conduct, they should check. And some of those other policies, very clear, ensuring that someone owns those policies and that they are using them. As you can see here, the list is, it's enormous actually, and there's plenty more of that. And then, of course, resource mapping and mobilization for sustainability. coaching each LIP to be proactive, like I said, and not reactive. Sorry to repeat this, but I think it's really important in mobilization of resources for sustainability. Very much working with them to ensure they've got a strategy and making sure that they don't just depend on one source of funding, but ensuring that they're always ahead and always thinking what if scenario. So we're really giving them some tips and support and confidence to think outside the box. So I've rushed through this, but I'm hoping you've gotten the picture in terms of our governance and executive leadership program with ASAP, but there's been some lessons learned. Clear understanding of different roles for executive directors and board members, basically. And also the importance of the board independence, as it ensures the board members' ability to fairly and objectively direct each local partner governance affairs without any conflict of interest or undue influence. Very much formation of a strong board is very critical, and that's one of those things we've seen in the organizations that we've already. There's quite a lot of organizations with those strong boards. Having your friend might be a support to you, but how much oversight they can contribute is negligible without the right skills you need on the board. And that was one of our mantras, to support each of the organizations. As I mentioned, number 4, board assurance is key. Through good reporting and getting the right information and perspective with regards to strategy, execution, and performance is pretty key. So the board really focusing on these key elements. And then, of course, training members is key so that they know the importance of their role in making due diligence, integrity, and being able to stand up for an important point of view. Very much, again, importance of decisions. We've talked about the committees. It's lovely. It was lovely seeing in the video the board member talking about the subcommittees, something that has really been embraced, and we are really happy about that. But also about the board contributing to a good culture of excellence, especially doing the right thing and supporting the ED and management. That joined up thinking, that relationship is really important. And one of my mantras in number 8 is very much about the importance of each of those boards and executive leadership, networking and managing stakeholder expectations. So we were very much, proactive in getting them to learn those skills. What is it? Do share some of the good that's happening. Let's celebrate and share with the donors as well, so they know what you're doing, so that it opens up some of those opportunities for more resources. So just as I go to finish, I thought it's really important. I know Catherine has talked and thanked everybody as well, but I think our success from, as an advisor with other colleagues, I know there are, many colleagues you heard about, I think 70 or so. Our success was very much about teamwork and synergy. Working as one individually, but as part of a team. So for instance, if I was going to one country, I arrived there, I'm not just going to work with the LIP, but it's also important for us to engage and get some of the others in finance, IT. We worked as a team, and that synergy was really important, and also sends a good message to the local partners as well. And also it helps not to overwhelm them, so that we are not all there at the same time. And then, of course, demonstrating a shared purpose to supporting our local partners. That's what's been really key. Focused on effective coordination with clarity on directions and priorities. And I'm sure, my colleagues would agree as well, paying attention to results for each LIP as they grow. It's really important. Success, honesty and commitment, but also sharing, really motivating them. But And how we did that, highly engaging them throughout the delivery of our work. And for me, I think, it's been really, really great. And also, lastly, ensuring best practice as our capacity advisors, setting and agreeing on objectives and principles, strengthening strategy upfront as part of prioritizing exercise for each organization. That's all important, paying attention to the needs of each LIP, leadership, the board, and holistically. And also commitment to enabling and empowering our local partners' leadership. Acting as a sounding board is one of those things that's been wonderful. So the example I've just given 2 slides ago, it's very much that dynamic that you almost made friends and, allies, moving on. But ensuring, again, I won't apologize for this, but the buy-in and ownership of technical assistance, because as you could see from the NUNUPAS assessments in some of those key areas, it's a lot, but the way we did it is such that everybody saw the good in it and people were able to actually take it and run with it. And of course, while we're working, it's very much been about paying attention to avoiding duplication or not overwhelming our partners as such. So thank you very much. That was board governance and leadership. Over to you, Catherine.
Thank you very much, Petronella, for a wonderful presentation. So that comes to the end of all of our presentations, and we do have a couple of questions in the Q&A. I can answer the first 2, and Petronella and Andrew, I'd like you to read the 3rd question and consider answers for that. So the first question is, will these resources documents be shared by email with registered participants? So before the end of the project, ASAP 2 will release a final newsletter, which will have all of the resource links. And that'll go to our listserv of over 11,000 people. So everybody will have access to the different links. The next question is, how can USAID support the newly established local implementing partner? So this is a question about USAID. And I can share from my observations that the missions that hired specialists in local capacity, such as in Côte d'Ivoire, they have a person designated solely to look at capacity strengthening of local partners. There are multiple missions that have this position. And what we found is if they have that position, we get a lot more done, and the mission is prioritizing capacity strengthening. Where that position doesn't exist, we find that the activity managers in the health office can often just be very stretched and not be able to pay attention to this because of their competing priorities. So that was one of the best practices we saw. We hope more missions are able to do that. The other thing we saw was when local partners have the opportunity to meet with mission staff, either at local partner meetings or through their one-on-one contact with the organization, relationships were able to be established, communication lines were able to be established, and local partners felt less intimidated once that personal connection was made. And that is why the local partner meetings are so important. It's also important for USAID staff to learn from the local partners' experience what it is that is challenging them, what do they need from you, and it's listening to their voices that shaped our program activities, in responding. And I'm sure with more opportunities to listen, there'll be more requests and a stronger partnership with each of the local partners. Now, the last question I've asked Andrew and Petronella to consider answering, what are the best approaches that the organizations can adopt to sustain the level of capacity that ASAP provided to them? Andrew, can we start with you? Would you like to contribute an answer to that?
Catherine, thank you so much. So I'll just, speak from what I've seen organizations that have gone through this process try and do. And one of the aspects that they've tried to is to try and institutionalize capacity building, which in a way is, just ensure that, training and aspects like skills development are inbuilt within the organization, so that the organization is a continuous, learning organization. And some of this could be either, internally, people who are specialists in those areas could be the ones delivering that training, or a prime, or in one case, receiving that support from a partner organization. So the other opportunity could be in terms of the communities of practice that Catherine mentioned at the beginning. So that those kinds of, whether it's peer networks, are also opportunities, that foster learning within the different organizations. Then also, you could also seek support, whether it's external support, and that would mean that as an organization puts together its funding request, or as conversations happen around organizational goals, they are able to also put forward capacity building as part. And this is more like tying capacity building to organizational goals, because what we've seen is that sometimes capacity building is treated as something different. If it happens, it happens, without necessarily linking it to the fact that, this is how an organization grows or gets better. Thank you.
Thank you so much, Andrew. Petronella, would you like to add a response?
Sure. I think it's very important that there is a good relationship, a good board with the right level members, and working very much in alignment with the executive leadership and with clarity about who is supposed to do what. But more importantly, I alluded to board assurance earlier on, and it talks to the whole organization as well. So it's important about the performance management system. Is there enough information going upwards to the board and back down in the organization, so that there's clarity about the responsibilities, about delivery of the strategic plan, and ensuring that everything, the risks are really being managed. And that is really important. And therefore it talks to each of those local partners very much having a good structure in the organization that is understood and that it works well, and they are always measuring their performance. And I think it's pretty key. And then lastly, I think with executive leadership, those managers, finance and HR and all that, I think it's very important. And that's something we've been doing, investing in their skills development, very much to bring them to that strategic level. So they're really working with the board, but they are also looking at big picture, such that it also, it also brings a very good dynamic with their stakeholders, stakeholder management, and the board, and assurance is very important. I don't know. I hope that's answered some of those questions. Over to you.
Thank you so much. I'll just add my thoughts to Petronella and Andrew's. So, and answering it from the opposite end, how can an organization fail to implement a USAID project? And the number one feature we've seen in organizations and funding that had to close down was risk mitigation and risk management. So conducting risk assessments for the board to be vigilant about anti-corruption efforts throughout the entire organization. So if the leader is not practicing anti-corruption practices, that permeates through the whole organization. And we have seen organizations where they show up to work and there's a lock and key on the door because they've been reported for fraud, and after the investigation, they've been shut down. So making sure that every step is taken to ensure anti-corruption practices are adhered to and promoted by the leadership and throughout the organization. On that note, let me turn to something more cheery. I do want to say thank you to everybody. Everything is available on our website. I put the link in the chat. You'll find all the business development, all the training manuals, the path to prime, everything in multiple languages. As ASAP 2 is closing out, we do have a very large list serve of over 11,000 people and growing. And when ASAP 2 ends, there's a new project that's going to start. It's called Global Health Risk and Compliance, GHRC. And we will be transferring our list serve to the organization that will be implementing that. So hopefully you will continue to get messages and they'll continue to have webinars and training materials. We've ensured a smooth transition from ASAP 2 to GHRC. And so many of us are looking forward to continued involvement with all of the local partners. On that note, I want to say thank you very much. It's been a wonderful journey and a real honor and privilege for me to be a project director, to meet so many people and to see so many successes. So thank you very much for your time. God bless until the next time we meet. Thank you.
Thank you.
And thank you for all the icons floating up. It's really lovely. Appreciate it. All right. Thank you very much.